Gentlemen, we are on a mission to help more men find the sexual health and the sexual freedom that they desire, especially when it comes to understanding what's going on with their body when it comes to things like ED. It's a topic that for a lot of guys, it's awkward. They're uncomfortable bringing it up to their doctor, to their partners, even sometimes looking in the mirror and saying, hey, maybe I have some kind of issue going on. And yet it's incredibly common. If you are a guy and you have any desire to increase your sexual wellness and your sexual health, this is a great video for you. Stick around. We're going to get into a really exciting therapy that we are absolutely loving here at Sage.
Absolutely. Hi, I'm Dr. Angela Yeagley. Welcome to Sage Health TV. This is Barry Napier.
What's up, everyone?
So wonderful intro. Excellent. So guys, definitely stick around for this conversation. I think if you haven't heard of this type of therapy and you are experiencing some form, mild to moderate to low severe erectile dysfunction, then this is something you need to know about.
And if you are experiencing some ED, it's very, very common.
Very common.
Some of the stats that we've saw, it's as high as 50-55% of men at some point will experience some form of ED.
Yeah, and it does increase. That percentage increases once you hit 40. The number goes out.
Like so many things, as we age, certain things become. Certain things do, certain times, Well, I would say things become harder, but it's kind of they kind of become softer in this case, right? So it's like the opposite.
Oh, I knew some of these jokes were coming.
Yeah.
Right?
So gentlemen, but no, in all seriousness, it is a topic that for a lot of guys they feel very uncomfortable bringing up to their doctors, to their partners. And if you have brought up or explored it, oftentimes. When you're dealing with ED, you probably have leaned toward or have been prescribed some type of prescription medication.
Yes, yeah. So, and guys, what I would say also that within this conversation, if you're one of my guys here, and I'm your doctor, when we're getting into talking about this therapy, that we do have a male technician. I just want to start with that. And I want to say that, as your doctor, and I would say this for, all female doctors, that we absolutely, 50% of my people are men. And so I'm very comfortable having this conversation. And so if you, I can always build a team around you. And so I just want to say that, absolutely, I definitely have these conversations often, and would love to have the conversation with you if that's something that is needed.
And you need to have these conversations, right? So if you're not talking to your doctor about it, you're not talking to somebody, you definitely talk to someone and start exploring therapies. Don't just use Dr. Google. Start getting into it, because there can be some other health ramifications and some other markers when you're starting to experience ED. There's a variety of causes that can get into a diagnosis of ED and dealing with the issue of an ED. So that's definitely why you want to bring it up, because there could be some other things going on.
Absolutely. And many times, say for the, handful of men, they're like, hey, I want to let you know this is going on, but I would like a male practitioner. I will loop them in with a urologist. You would no problem. We're going to get you set up. So again, while doing the underlying things and the testing on cardiovascular risk, right? Mm-hmm. Because we know generally the type of, there are many potential contributors to ED, but I would say the number one is going to be cardiovascular, right? Where there's decreased blood flow to the penis, right? That's number one. But it doesn't mean, that there can't be some mental emotional, or there could be sometimes nervous system issues going on as well, or we need to be addressing diabetes.
I was going to say there could be metabolic syndrome, there could be stuff going on.
Yeah, there can be a lot of, and sometimes, one of the pieces is that they're exhausted. Right, they're so tired that there's no energy.
Low T. We've talked a lot about testosterone therapy for guys as part of our sexual wellness and just men's health issues, and so you could have a hormonal issue. It could be a combination of a few of these things.
Absolutely.
And so when we're thinking about how do you treat ED, we might have a comprehensive approach, but then there's also very targeted therapies, and that is what we want to talk about today with this vascular regeneration, and talking about this application of a specific type of therapy here as it relates to ED.
Yes. So regeneration, regenerative therapy for ED, essentially what we're talking about is a very specific type of sound wave treatment that when applied, it's directly applied to the penis, right? And what it does is pretty amazing. This particular therapy and using sound waves can increase actually the body's ability to make new blood vessels in the area that it's applied. That's incredible to me. So if you're thinking, okay, there's a decrease in blood flow, which happens with aging and cardiovascular disease, like this can actually help your body make new blood vessels. That's super cool. Also, recruit like stem cells to the area. Also another huge thing, right? Stem cells are very big these days. Like anytime we can recruit or bring in stem cells for new cellular growth, to me, it's incredible. It's like that in itself is amazing all by itself. Then we have actually increase in like tissue mass from the treatment. And so also again, increase in tissue mass isn't probably another thing that people would be happy about.
So, I mean, if you think about it, the way I like to think about this is it's almost like, this would be like sending your Johnson to the gym.
Yeah.
Okay, this is how it gets its pump on.
Yeah.
All right, it gets a workout, it increases blood flow, circulation, increases the tissue, the responsiveness of the tissue, right? And all of those things breaks up little plaque deposits and little things inside the shaft that can be impinging some of that blood flow and restricting it. So it's really in that way a pretty incredible therapy because it's creating new cellular growth, and that's very exciting whenever that can happen and whenever we can trigger that factor in our body, because we're not just then treating it with a medication that increases like a nitric oxide increaser, right, like our
like Cialis
or Viagra, whatever. This is actually affecting the underlying biological mechanisms that allow the Wang to like come online.
Yes. And so now, and you can still incorporate. You can tell Barry's very proud of himself. Really.
I have a list of
names. They're coming. Yeah.
I hate the word
just
penis. I hate it. I hate the word. So I was thinking all the different ways.
I'll switch. Family. Johnson. I'll start. I won't say.
You can say it. It's very.
Just think from a medical perspective.
You can take them out.
You're right.
It's fine.
Oh, Johnson from now on, but that's okay.
You can You can stick with penis.
Maybe I'll stick with penis.
Okay.
Yeah. So you can still use, like, say if you have been using Viagra, Cialis, or the generics of those, or you're doing a pump, or I know urologists have a lot of tricks up their sleeve as far as like different types of injections. You can do these therapies. Now, if they're very specialized, like injectables you're doing with a urologist, we definitely want to confirm with them that you can do the therapy first. But most of them, you're going to be fine to incorporate these. We can use multiple things at one time, to achieve this goal, essentially. So the studies around this are really, really good, really good. Many studies on using, so the type of therapy, we're going to say it now, which it can be a little shocking, so we're mostly trying not to use it, but it's called shockwave therapy, right?
And to be clear, it doesn't, there is no electrical shocking that happens. It's talking about the sound wave that this particular machine produces that is, of course, transmitting the energy deep into the tissue. Right, so the shockwave, sometimes people get a little scared when they hear that, like shockwave.
It sounds a little terrifying.
Yeah, but it's actually a very gentle, non-invasive treatment. It's very, very gentle.
Yeah, well, mostly, yes.
Mostly gentle.
Mostly
gentle-ish.
We'll talk about you have to numb, but you're going to be okay. You're going to be good with the numbing. So we start out, a lot of these studies are based on a SHIM score, and so that's what we use here, right? It's basically an outline and a questionnaire of everything you're experiencing, of like nocturnal erections, daily erections, and just goes through, a lot of questions to really try to get quality and quantity.
Yeah, get a sense of how, where's your erectile strength at, and the consistency and frequency, and like how are you feeling, and are you like able to, get in there and do what you want to do, or not so much, and if so, what kind of support do you need? All that kind of stuff gives us a baseline to understand where you are in a continuum.
Yes, and are you responding? Like if you use Viagra, like, do you respond to it? Because that's really important. Because I will say, if you're at the place where if you're taking, any of those medications and there's no response, this therapy still could help, but it is going to be, the possibility is less, right? So still worth exploring, but the areas that people really respond best are going to be mild to moderate ED, and low severe. So If you're using, Cialis Viagra and you're getting a great response, or it's starting to, you're like, oh, it works sometimes, not always. That's okay. That's great.
That's a
Come on
perfect
in.
candidate.
Yes.
Yeah, that's the sweet spot for
Yes,
this therapy.
absolutely. So based on these scores, these studies are incredible. So we'll talk about the treatment plan, but essentially they go through a treatment series, and so I would say there's a lot of studies, and most of them are finding like 70 to 75% plus of men are getting significant changes in their ability to maintain and have an erection. So and one of the studies which I thought, and there are many like this, but this particular one, 27% of men who underwent the treatment completely resolved their ED, which I thought, that's incredible.
Yeah,
right?
30%, close to 30%.
Yeah, like, I mean, the use of sound waves, right, to completely resolve the issue. And then the rest of them, it went up to like almost 80%, going for of had a significant or a very good resolution of, of their issue. So that's exciting, I think,
It is.
Yeah.
Yeah, especially I think even if you're at that spot where you would just like a little bit more consistency, you mentioned when maybe a person's at a spot where they feel like they've had to up the dose on their medication, or maybe they're doing, it's just a little bit inconsistent, and you want to feel more of that confidence, and you really want to start addressing some of the underlying biological mechanisms so that you're just not taking a medication that's treating a symptomatic, but it's also now addressing something that's a little bit deeper and tapping into that regenerative power of your body. That can feel really good too, because it at that point you're working on yourself and you're creating a longer term solution, because this is something that can be done periodically, and for some people, as we talk about the treatment plan, that's one option. It can be something that's done every year or every few years. Other people go through a series of treatment and find that they're good for a long time. So it's just depends a little bit on how a person responds. Everybody's a little bit different in terms of how they respond to the therapy plan, but maybe let's walk through what a treatment plan looks like.
Right, exactly. So great. So this is based on the studies. So this is standard protocol when you're getting this particular therapy from any office. So the starting treatment amount is 6 treatments. So it's going to be 1 a week for 6 weeks. So that's where we start, although sometimes that's where you end as well. Sometimes you just need the 6, and you'll get a great outcome with that. So that's what I would plan on. And the reason why it's set like that, because what's really common is that sometimes men with the first treatment, they're like, oh my gosh, like, yeah, this is kicking in, this is making a difference. And then the second, third treatment, they don't notice a whole lot. So there can be a tendency to be like, oh, wait a second, this actually isn't working now, and I don't know that I want to do it. Nope. It's still working, actually. There's still changes that are happening to the tissue, and you need to keep going. So
yeah, with regenerative medicine, what you have to keep in mind is that it's not an instantaneous thing, right? So basically what we're doing is we're periodically on a kind of consistent schedule applying this energy to down there. And what happens is that over time, right, as we go through this treatment protocol over a number of weeks, that regenerative process is kicking in. It's kicking in. It's kicking in. It's kicking in. So it sometimes can go the other way too, where after the first treatment, really not a big difference. Number 2, number 3, things are starting. You really start, and then 4, and then 5, and then 6, because now you've had long enough time, and there's a regenerative process that goes on. It's just like anything with the body. It takes a little bit of time to heal. It takes time for those cells to get activated, right, for those biological changes to take place. So it's really exciting to kind of go through that whole process, and then even after that last treatment, that 6th treatment, there's still a window of time where you're still getting benefit, right, where the body's still going through this regenerative
a couple
process
months afterwards. Yeah. So that's where, I mean, so like, say if you're thinking, okay, I'm at my 6th treatment, right? You are still getting benefit at that time from your first treatment. There is still, like, the effects of that first treatment, they're still stimulating. They have pushed and stimulated blood flow increase and the building of those new blood vessels, right? And that they started the process, that first treatment of bringing those stem cells in, that is still going from your first treatment, like when you're at week 6. So of course, now that you're at week 6, that is still going to keep lasting a couple months after in healing, which is, I love that.
It's amazing.
Yeah.
The treatment itself is pretty quick.
Yeah.
So you come in here at the office, you kind of go through your questionnaire, all that kind of stuff. There's a numbing process that we do. So there's a numbing gel we give you. You kind of apply that to the shaft and kind of surrounding pubic area, right? And that just helps lessen the kind of tone the experience down a little bit. The device itself produces a small kind of pulse of energy, and I wouldn't say it's not a painful pulse, but you can feel it, right? So with a little bit of that numbing cream, it just kind of smooths the whole experience out, and it really almost feels like nothing with the numbing cream going on. And then it takes about 15 to 20 minutes after that numbing cream has kicked in. That's about 20-30 minutes, and then we get into the process itself, another 15-20 minutes. So you're looking probably all said and done about an hour.
Yeah, plan on being here for about an hour. The numbing is obviously it's painless, right? You're just hanging out while it's kicking in. So
yep, and then the numbing will stick around for a few hours afterwards. So like I would
don't
say,
plan on anything.
I wouldn't say that's not like a Magic Mike style night that night. Like, you know, that's not where you're gonna bust out like your moves and just be ready to just be like, wow, check it out. This is ready to go.
Yeah, don't plan on that evening. Yeah, right.
Totally.
Yeah, the numbing cream. The nice thing about it's actually quite powerful. We use it a lot also for like our facial treatments and for ladies. Actually, this is a treatment for different reasons. You can do this particular therapy for women too, for tightening, and they also are going to be numb. So it's a cream that works really, really well. And so, you know, just based on like feeling anything, it's just going to make it super comfortable, which is nice. Yeah. So yeah, plan on an hour, plan on 6 treatments. Now could you do more? So there are people who are in that kind of higher moderate, lower severe that end up repeating a second 6, right? So this will be something that we talk about, you know, how much did you improve? Does there still seem like there's room there to improve? You know, where did you begin? Were you kind of at a place where we really needed to work on things, right? And maybe you've got some other things happening too. Maybe we figured out you also have low T and some blood sugar issues, and we're working on those, right?
Maybe we made some lifestyle adjustments to stress and sleep. Maybe there's been some body composition changes.
Yes, exactly. So we might decide, okay, and this is in the research as well, studies on this also, we do a second 6. So that's very possible, but it's a decision that will be made at the end of that first 6, you know. So, and then what happens after that? Like, you're like, okay, I've got this, I'm better, this is good. Many men will do a few treatments that next year of just maintenance treatments, essentially. They'll come back in just for a few, like 3, just to keep that stem cell recruitment going, to keep the...
Just a little tune-up.
Tune-up, yeah, exactly.
Just keep the blood flowing, keep that muscle tissue building for the old twig and berries.
Yeah. This is good. We're hoping Barry has the opportunity to use as many of these as possible.
I have long lists.
Yeah.
Barely scratched the surface. Yeah, so if this is something that sounds interesting or appealing, you want to find out more, what are the next steps? Yeah,
so please give us a call. You can find us on the website, chmedclinic.com. Please reach out. What we'd want you to do is, if you're not already an established patient, to set up a new patient visit. And if this is what we're focusing on, normally we see people for an hour, which is great. Love to see you for an hour. But if you're like, you know, I really just want to have time I'm really going to focus on this. We can do a shorter one to get you in and just get going. That's fine. But ideally we'd have the longer time with you so we can give you that, you know, whole comprehensive, personalized, holistic plan, you know, to really set you up for just amazing long-term health, right? Overall. So make an appointment. If you are an established patient, then just, again, make an appointment. Come on in. Yeah, let's come in, we'll review it further, and then we do have packages, so we do have discounts if you are purchasing all 6 at the same time. So that's nice, a little bit of savings.
Absolutely.
Yeah.
Don't sleep on it. If you need help, or if this is something that you're worried about, come and get help. I mean, because it's a really powerful therapy, and it can do some really incredible stuff to improve your sexual health and wellness.
Absolutely. Well, thank you for joining us.
All right. See you next time.
See you next time.